NBC5 responds with a new warning about a growing fraud that's targeting one of Illinois' most vulnerable populations. Taxpayers lose billions of dollars a year to Medicare fraud.
And here in Illinois, that means roughly 20% of Illinois residents who rely on Medicare may be left without access to the critical medical services that they actually need. NBC5 Responds PJ Randhawa shares one thing you can do right now to find out if scammers are profiting off of you.
The numbers are pretty shocking. According to the Centers for Medicare and Medicaid Services, the government spent almost $950 billion on Medicare funding in 2022. But according to the Department of Justice, an estimated 6% of that, or $60 billion, went straight to scammers. Medicare fraud happens when someone bills your Medicare account for something you didn't receive or for something that wasn't prescribed by your doctor.
I looked at it and I saw urinary catheters. PJ, 2,000 urinary catheters were billed.
For retired nurse Linda Hennis, it was catheters, $15,000 worth of them that she didn't need and didn't order.
I've been on the giving end of a urinary catheter, but never the receiving.
Linda says she noticed the charges on her Medicare summary notice earlier this year. On it, you can see 10 separate charges for catheters from a company called Pretty in Pink Boutique out of El Paso, Texas. Linda found their website and another piece of the scam.
Up came the site with this huge disclaimer. If you think you're calling about, if you're calling about urinary catheters, you may have been a victim of Medicare fraud.
The boutique's website says they've received dozens of calls from people like Linda, and they are not the ones billing Medicare for catheters. They say there are at least 5 companies registered with Medicare that share their name, but their boutique doesn't even sell catheters.
A lot of them are just shell companies, and they're out of business real fast. They make their money and then get out real fast.
Travis Trumich with the nonprofit Age Option says other devices often used in the scam include knee or back braces, but catheters are the most popular. He explains how these Medicare billing scams usually begin.
So what happens is that a call center from overseas calls the beneficiary. They get their information from the dark web or a data breach. They call the beneficiary and confirm all their information. And once they get that information, they sell it to a durable medical equipment company.
Linda reported the scam to Medicare immediately. Even though she wasn't billed directly, she knew she could face consequences down the pike if she didn't.
If your Medicare is billed for a device or equipment at some point and paid for, and then later on you legitimately need that, they can deny it.
It doesn't really hit the consumer unless they need it later in life, but it really hurts the American people because of all the tax dollars wasted.
Here are the key takeaways. Never share your Medicare number. Beware of unsolicited phone calls asking to confirm your medical information. Medicare will not call and ask you about that. Now, keep records about the medical services you actually received and monitor your Medicare summary statements. This also applies to those who have private insurance and receive explanation of benefits summaries. It's on these notices you're most likely to find out if your insurance information has gotten into the hands of a scammer. For more information on how to report Medicare fraud, visit NBCChicago.com/consumer. PJ Randhawa, NBC5 Responds.